every time you decide that, I'm so tired from such a hard day, I just can't even get in 10 minutes, you think of that statement and that'll give you the boost. Just do 10 minutes. I guess my take-home message is that instead of talking on the phone at lunch or doing something that's not very productive, go out and take that 10-minute walk. You won't get so sweaty that you can't go back to work. Get out, get some fresh air, and get 10 minutes worth of exercise in. 75 to 90% of visits to a primary care physician are due to stress-related complaints. Is that unbelievable? And certainly for all of us, this pandemic has been a very stressful time.
Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists podcast. This is episode number 280. My name is Andrew. Listen, everyone, we have a great show for you today. It is a little bit longer. And so because of that, hooray, this is going to be a little bit shorter of an intro. If this is your first time listening to this podcast, it is a dental podcast, and we cover a wide array of topics. In this particular episode, we're listening to Machell and Machell as a co-host talking about women's health. If you like this episode or any of our other episodes, please be sure to subscribe, tell your friend, have them subscribe. We also will be at ADHA conference coming up in June and RDH Under One Roof in July. So if you're going to be there, make sure you guys message us, let us know you're going to be there. We would love to meet up. It's going to be a great time, and we will see you there. I promise I would keep this really short. So here it is, the interview. Before we get to the interview, we want to say a big thank you to Paradise Dental Technologies, or PDT, for supporting the continuing education portion of this podcast for so many years. If you do not know already, many of our full-length episodes count for CE. You'll find the links in the show notes, or you can sign up for our newsletter by going to ataleoftwohygienists.com. When you sign up for the newsletter, we will periodically send out links to shows that have expiring CE courses attached. And none of this could be possible without the support of the amazing people over at PDT. So check out their hygiene and other instruments at pdtdental.com. That's pdtdental.com. Now, on to the interview.
So welcome to the interview portion. I'm really excited. This is Women's Health Month, and so I am very excited for this particular episode. And as a co-host, I have Miss Machell Hudson coming on with me to help me, deliver this message. I'm so excited to have you back on, Machell.
So everyone, I'm pinching myself right now because I don't know, for those of you out there, it was 2 years ago next month, Machell, that I was my first podcast and with A Tale of Two Hygienists, and I was so nervous. And from that podcast, Andrea Johnson from Crest Oral B heard that, and that's really where my speaking chapter began. But I was a fan of Machell and Andrew's for so long before that, and crazy fan. And so this is, it's crazy to look back and see where I was, and through the love of my friends and encouragement, what they gave me the courage to become so much more. And what a perfect time to talk about that than right now, Women's Health Month, because that's part of it, that love that we share with one another, that is part of all those pillars of health. So thank you for inviting me. And I am so excited to be co-hosting and pretending to be Andrew for the episode, and with the guests that we have today. Wow, it's incredible. Thank you.
I know. No, this is great. I'm excited.
I'm going to have to say real quick, by the time this airs, it will have passed, but happy birthday, sweet friend.
Thank you. It was my birthday yesterday.
Oh, happy birthday.
Thank you. 39. So I got a lot of women's health things that are coming up on I need to probably get some checkups and things like that. So thank you very much, though. And that leads me to introduce our guest today, Dr. Barbara Steinberg, and Uche Odiatu, who is a return guest, one of our biggest fans, and we are one of his biggest fans. I said, do you have somebody that could speak on women's health? And he was like, oh my gosh, you have to talk to this wonderful woman. She's amazing. So welcome to the podcast, Barbara. It's so great to chat with you.
Machell. I appreciate both Michelle's. Thank you. I'm delighted to be here. And Uche is just a wonderful, wonderful human being. So I'm so happy that I have his endorsement.
Yes.
So let me introduce myself. I'm Barbara Steinberg. I have been a practicing dentist since 1974. That's just a few years ago, right? I completed a 2-year residency at the Medical College of Pennsylvania in Philadelphia, knowing that I always wanted to be in hospital dentistry and treating medically complex patients. And this was back in the 70s when it was just starting out to have dentists treat people with all these encumbering medical issues. And I decided at that point that I would work towards getting boarded in oral medicine, which I did. And I worked myself up to become a full professor of medicine and surgery at the medical school. And my secondary appointment was at University of Pennsylvania School of Dental Medicine in oral medicine. So currently, I'm at Drexel University College of Medicine, where I'm a clinical professor of surgery, and I still have my appointment at Penn in oral medicine. And I devoted my life to treating patients with all kinds of medical, mental, and physical issues where they needed OR care. And I was blessed to be working with a fabulous team comprised of general dentists, endodontists, periodontists, oral and maxillofacial surgeon, hygienists, expanded function dental assistants. We were the whole team that would go to the OR and treat these patients in one day and address all their oral health care needs. I did this up until about 1.5 years ago when two of the people, my main people on my team, decided that they couldn't do these cases anymore. So rather than break in a new team, I said, okay, my track record was great. And what was that? Every patient left that hospital in better shape than when they came in. And when you treat ASA class 3-4 patients, let me tell you something, that is a real feat. So I was just thrilled doing this. And then I also started speaking nationally in 1979. It's before most of you in my audience were born, but I was one of the first female clinicians on a national dental program. That's in 1979, the American Dental Association's annual meeting in Dallas. So that was a few years ago too. So that's enough about me. I am thrilled to talk about women's health. I've chosen topics that I thought would be of interest to a wide range of audience. I'm picking subjects that are more germane to the younger woman and also to the more mature woman. Notice I didn't say older, I said mature. So with that, being National Women's Health Month, I mean, I think the goal for all of us is to age optimally. Yes. I mean, not only do you still want to look good, but we got to feel good. And when we talk about taking care of number one, that's us. Unfortunately, too many of us don't make ourselves number one. And we need to talk about our physical health, our social health, and our emotional health. And I'll try and address each of these categories. And unfortunately, I can't discuss every topic today in women's health, but we'll have a pretty good smattering. So let's start off with a little bit about our physical health. And let's look at, you don't want me to start with this one, I know, diet. And nutritional concerns. Oh my, the pandemic really did most of us in, including me. Do you know they just came out with the statistics?
20, right?
Yeah, well, the pandemic quarantine 15 or whatever. Do you know that the studies just came out and said that the average weight gain during the lockdown was about 2 pounds per month? So, I mean, it's really, that's unreal, isn't it? Yeah. So when we talk about diet and nutritional concerns, everybody says, well, what's a healthy diet? What should we be eating? Most people think in the know that the Mediterranean type diet is probably the healthiest, where we're consuming a lot of vegetables and fruits and grains, and we're replacing butter and fats with like olive oil, and eating nuts and limiting your red meat. And of course, you can have that red wine, just that one glass. Remember, for women, it's one glass a day. Men can have two of an alcoholic beverage. But when I say a glass of wine, it's only 5 ounces. That doesn't go too far, does it?
Not even fair.
Anyway, yeah. So that's part of the Mediterranean diet. And unfortunately, what has happened during the pandemic is that being home, most people are really imbibing in lots of snacking. In addition to good dietary intake, we also have to move. We have to exercise. Unfortunately, we can't get anybody to do that for us. We have to make the time to do that. And basically, it's still for women about 150 minutes a week of a moderate type of activity, or 75 minutes of a more aerobic, really like a runner. I think one of the great things that's come out, though, in the literature over the last few years, we used to think that you had to have a half an hour at a time to be really efficacious for good heart health. Now we know that there's no time limit, that whenever you can grab those few minutes, you do it. I mean, during the pandemic, my family thought I was crazy, but when I had time and I didn't want to go outside, it was too cold or whatever, and it was before I bought a treadmill for my house, I'd run around the house, back and forth, up and down the steps, up and run. I did my jumping jacks all day long, whatever. So whatever it's going to do to get your heart rate up, if it's a few minutes at a time, take it. It doesn't have to be the long periods. So we really need to try to get that into our lives, as well as resistance training, whether it be free weights or the Dynabands or Nautilus, whatever it is, you need to do that about 2 to 3 days a week. And in addition, as we age, we like to incorporate those activities also that will help with balance, because that's one thing as you get much older, or rather mature, we tend to have a lot of people have balance issues. So if we want to try to combine our physical activity with social activity, we should try to do this with our friends and family. So you're killing 2 birds with 1 stone. You're getting your physical activity and you're really contributing to good social health. So I want to tell people also that, you don't have to invest in, this expensive machinery for exercising. One of the very best forms of exercise is walking. And studies are plentiful to demonstrate that you don't have to be an absolute super power walker, just, even more than 3 miles per hour. If you do that consistently several times a week, you can definitely reduce your incidence of heart disease as we age. So walking, and most people can do this unless you have some musculoskeletal issues, you have problems with your feet, but the majority of people out there can walk. So that's what I think is the best through all the age groups, because you are pulling yourself against gravity, which is what? It's protecting our bones. And I'm going to talk a little bit about osteoporosis as we get further on in the talk. So it's pulling you against gravity. So it's getting you, helping you keep good bone mass. And if you walk at the rate, at least 3 miles per hour, which is not that quickly, you can have some cardiovascular benefits. And one of the key studies, the benchmark studies I love that came out of Harvard, that said that this was done on the women, on the nurses, this study, they said that even women that had multiple risk factors for heart disease, they had high blood pressure, they were smokers, they had high cholesterol, they had a strong family history of heart disease, that even those people, or even with all these encumbering risk factors for heart disease, by walking, they minimize the risk of developing heart disease. And we are going to talk about heart disease today because It is the number one killer, women, not just men, but for women too. And too many women, even well-educated women, do not believe that their chance of dying is greatest due to heart disease. So I will absolutely stress a lot of things because a lot of the symptoms of heart disease differ in women as compared to men. So I love this quote by a Canadian motivational speaker. I don't have to ask Uji if he knows this person, but I love this quote, and I'm going to give this person credit. It's Robin Sharma, and it says, if you don't make time for exercise, you'll probably have to make time for illness. Isn't that great? I love that. So every time you decide that, oh, I'm so tired from such a hard day, I just can't even get in 10 minutes, you think of that statement, and that'll give you the boost. Just do 10 minutes. And remember, and this is what I try to tell people, if you can't get the full amount in a day, take whatever you can take and do it. Just even if it's a few minutes, it's better than nothing. And the studies show that. In fact, one study, let me quote it. It said that even 70 minutes a week, which the last time I calculated that, I'm not exactly a math major, was 10 minutes a day, that even that 70 minutes a week, they saw some reduction in heart disease, anxiety, depression, diabetes, and other conditions. So I guess my take-home message is that instead of talking on the phone at lunch or doing something that's not very productive, go out and take that 10-minute walk. You won't get so sweaty that you can't go back to work. Get out, get some fresh air, and get 10 minutes worth of exercise in. So that's my plea for good nutrition and exercise. And then another thing that has been very problematic during this pandemic, and that has been sleep. When I was a resident in my years at the hospital, putting in absolutely crazy hours, I always used to get very surprised when people prided themselves with how little sleep they could get by with. 4 hours,
Wow.
5 hours. And they used to brag about it because they could fit so much more into their life. And they thought it was just a miraculous thing that they could do so well with 4 or 5 hours a night. I'm happy to say we now have some science to back up what is the recommended amount of sleep. And the National Sleep, the Sleep Foundation came out with recommendations at every age level, how many hours of sleep you really need. So for most of my audience tonight, I'm assuming that we're probably in the 18 to whatever. I'm 71, so I'm sure that I'm probably the oldest of everybody. But in this age range, it's anywhere from like 7 to 9 hours. That's not 4 to 5. And people say, oh, you only have one life. Why do you want to waste your time sleeping? Well, I have to tell you, they're now showing, it's been well documented in the scientific literature, that sleep deprivation can be one of the risk factors for coronary artery disease, anxiety, depression, migraines, decreased function of our immune system, increased sensitivity to pain, insulin resistance. Should I go on and on and on? So suffice it to say, no longer 4 to 5 hours. Let me just tell you a point that I thought was very interesting. When former President Clinton went through his second round of cardiac issues. Remember, he had bypass, and then before Chelsea's wedding, he had to have stents placed again. And he was asked, they said, President Clinton, this is now your second go around. What are you going to change? So, you're lucky you're alive. And he said, well, he doesn't go to eat his cheeseburgers. Remember, he was big on the cheeseburgers and things like that. But he said one thing that he was really going to try and work on. He was only getting 4 or 5 hours of sleep, and he was going to definitely get more sleep. So we know that that is a risk factor for heart disease. So he looks pretty good. I guess he's working on that. Plus, I think he went through a period of time, I believe he was either vegetarian or vegan, but then I heard he switched back. I don't know, but he looks pretty good. So I'm assuming that he's carrying out his plan. So knowing that sleep is such an important part of our overall health and well-being, I really hope that you'll all consider that and certainly try to organize your day so that you can get sleep. Now, people always ask me, what can you take to sleep, and things like that. Well, I have been taking melatonin for a while. I'm not real big on prescription sleep medication, so I take melatonin to help me sleep. Sometimes it works and sometimes it doesn't, but I really try to get the proper amount of sleep. And, they tell you that in order to get the proper amount of sleep, you have to exercise good sleep hygiene. And what does that mean? Well, you may not want to hear this, but they don't really want you to use your bedroom for anything but sleeping and sex. So that means watching television and being on your laptop or your phone before you go to bed, or eating a heavy meal, or exercising too close to bedtime. All these things are no-nos. And plus, a lot of people don't have good curtains, so they don't block out the light. They don't have good, comfortable beds. So there's a lot of reasons why people are not getting a good night's sleep. So I'm hoping that everybody will consider trying to exercise good sleep hygiene. Oh, but the other thing is, and I learned this because I like to always be warm when I sleep. And they are now saying that you really shouldn't have your room warm. It should be in the 60s at the highest, 70 at the absolute highest.
I
And
just don't understand.
yeah.
I'm like, I'm you. I'm like, I want it to be warm. I was like, I'm on board with so much of the sleep hygiene, but the cold room, I'm like, but
cold
Preston, I
room,
got to get out of the bed.
68.
Yeah. But
Mine's on 68. But when I wake up, I turn it up. But while I'm sleeping, it's on 68.
That's good. 60, that's great. And the other thing that people don't realize, how you always just people say, oh, I'm going to have a little shot of whiskey or a glass of wine before I go to bed. That's a no-no too. You might fall asleep, but it doesn't help to contribute to that good long sleep. So that's not something to do. And the other thing is, for those people that tend to worry a lot, which I think might be a lot of us, they say you should write down all your issues on paper or dictated in your iPhone, whatever, before you go to bed, so that you don't have to wake up in the middle of the night to remember everything that you were worried about. Sounds good, right? The other thing is, some of you may have bed partners that snore. That's not conducive to a good night's sleep, a snoring bed partner, right? So I worry about that, because you can get up and maybe move to your sofa or another room. I worry about the snorer, because we have to have that person worked up to see if they have sleep apnea. And sleep apnea is a major contributor for heart disease later on in life. So we certainly like to act upon that. So I'm talking about another aspect of our emotional well-being, and that's stress. And certainly the pandemic was, and still continues for many people, to be a tremendous source of stress. 75 to 90% of visits to a primary care physician are due to stress-related complaints. Is that unbelievable? And certainly for all of us, this pandemic has been a very stressful time. Yeah.
Depression's gone up 457% since January 2020. Anxiety's gone up 406% since January.
Yeah, I was going to tell you, thank you. They're escalating tremendously, and the stress.
And that hasn't changed. I started speaking that at the end of the summer, and I checked it before my last presentation, and it has not changed.
Yeah, it's unbelievable with the stress, anxiety, depression. And it's not, obviously just for women. I mean, it's our children. It's people of all ages. We've all been impacted by this pandemic in different ways. Some, of course, a lot more than others. Stress just really affects our eating pattern, our sleeping pattern, our ability to concentrate. Stress is also now a risk factor for heart disease. When I was in training back in the 70s, we surmised it was a risk factor. Now we have scientific evidence to prove it is a risk factor. So this pandemic, I mean, there was issues with stress since the beginning of time, but it has certainly, as Machell has just addressed, the stress, anxiety, and depression has escalated tremendously. So what I did a lot during the pandemic when we were sheltered in place, I did a lot of meditating, mindfulness meditation. And I had done formal training several years back, and I would listen to tapes and I would, meditate, which they think is a great way to help people reduce stress. And I did that quite frequently. I haven't been as vigilant now, but I find that really, really helps. For those of you that may not be familiar with mindfulness meditation, it's being in the present moment and concentrating, for example, on your breathing and thinking of nothing else in your life. And it really does help to quiet your mind and to really de-stress you. And it's interesting because Dean Ornish, who is one of the premier preventive cardiologists, and he runs a team out in Sausalito, he says that just the practice of focusing your awareness on something quiets down your mind and allows you to feel that inner sense of peace. Even a minute a day of meditation will carry you through the day. Now, did you hear that? I'm giving you all these ways to cheat. 10 minutes for exercise. We can all do that. A minute for meditation. We're only up to 11 minutes now. And look what we're doing for ourselves. So for those of you that were blessed during this pandemic to have a pet, oh my goodness, how lucky were you? Because they say when you can hug someone every day, that's a great stress reducer. And we don't all have that someone to hug in our lives. Many people were very isolated during this pandemic and very much alone. And so many people that live alone just said, I've read so many commentaries how having that pet was just so instrumental in their life during this very difficult time. And there really are studies that show that by hugging a pet, usually it's a dog, that it can be very, very instrumental in lowering our blood pressure and stress hormones. In addition, people who have sex regularly now, that was very difficult for lots of people that were by themselves, during the pandemic, didn't have a partner. The partners were somewhere else, but that's all right. They got around that, and they said that self-pleasuring counts. So for those, you can't buy that. See, that's another loophole. You can't say, well, I didn't have a partner, I didn't have sex. Well, they're saying that masturbation counts. And they say,
okay, and let's be real. There's probably some singles out there that are enjoying it a whole lot more.
A lot more. I like that. Well, I was going to sort of say something like that. I'm glad you said it. So
and it's an important thing to say.
Yeah, I think it is. That's true.
Yeah, they say that people that have sex regularly at least once every 2 weeks responded better to stressful situations, and their blood pressure elevated less than those who didn't, whichever way you'd like to achieve the orgasm.
So was regular twice a month?
That's what they that's what they said. Right, that's how they were clear. I didn't make that up. That's what this quote was.
Okay.
Yeah.
Wow.
Where they got
that is a lot less than I would have thought. So check that box. That's an easy box to check, y'all.
I have a whole lecture on my 4 S's of optimal aging. I can't get to all that, but sex is one of them.
Okay, so we're going to get together outside of this.
We are.
And just as long as we get our 7 to 9 hours of sleep, we're good.
And we stick to the one drink, right?
Oh, that's where Machell and I might struggle, but we will definitely try.
Of course, men can have 2. So they got to speak with that, right? So anyway, we all need support systems, talking about social health. And for many people, this was just so difficult during this time. But somehow with social media and all the technology that we have today, this kept people going, even if they couldn't have people with them physically, that with FaceTiming and all the other modalities that we now have, we were able to have a support system. And what really helps in maintaining good emotional health is having that positive attitude. Is the glass half empty or half full? And, you think about that being, that's an old wives' tale. It's really not. Because they've done some good research with what a positive attitude and optimism and how it helps in healing. And also that sense of humor, and not being Debbie Downer, but having that very positive outlook as well as the sense of humor. So I guess that I've summarized a lot when it comes to emotional, social, and the basics of physical health with our diet, nutrition, but also now what we're seeing during the pandemic, so many people did not keep up with routine screenings because they were afraid to go to a medical office or dental office. And of course, we were only open for emergencies. There were very few. I'm talking about screenings mainly in medical now. And some of this has been a real detriment where now we don't have the tally yet to see how many cancers were missed and how many people waited too long to have the complaints of cardiac issues addressed. So we don't know the exact number. Yeah, Machell, you want to?
Because you talked about cancer, I have to tell this story.
Please.
One of my precious patients that I've been seeing her, I've been in my office for 13 years in July, and I've been seeing her for most of that. And she was supposed to come in. She was due for her 6-month recall literally the month that we were sent home. So the end of March 2020. She was called. She's one of my favorite patients, and she's in her early 80s, very healthy. She's just a beautiful, vibrant woman. And she did not want to schedule because she had a sinus infection. And I sent her a text message, and she sent me one back. You know, I promise I'll come in as soon as my sinus infection is cleared up. Fast forward to late September 2020, she called and she said, I think I just need to come in. I mean, it's been a year since I've seen you, and the sinus infection is not going away, and I still have this ulcerated area in my mouth.
Oh, wow.
And I was like, Betty, just made up that name. I was like, Betty, you're not supposed to have an ulcerated area because of sinus infections don't do that. And I said, I want you to come in and see me. And so I got her on my schedule, and unfortunately it's cancer and stage 1. So like, let's celebrate the fact that we still
Stage
caught
1.
it early.
Yeah.
But she did lose part of her mandible. And, we never want that to happen, but you're absolutely right. Just imagine, all I can think, and it makes me so sick because, we go back as clinicians and we're like, okay, did I miss that? And because of all the documentation and the intraoral pictures, the scans that we take, we know we didn't. But I still think my heart is like, oh my gosh, what if I'd have seen her in March when I was like, if she had just been able to come in before that happened.
You tried. I mean, you did what you could. Yeah.
So thank you for saying that. And because you're right, like how many more people are out there with that same story?
We don't have the numbers yet, but people that had bad outcomes with cardiac issues because they didn't get worked up. I mean, there's just so many things. So please, all of my viewers today, encourage your patients to please keep up with not only their dental appointments, but also all their medical screenings that are germane for their particular age group or whatever. And you know that varies. I don't have time to go in today to what you should do in your 20s, 30s, 40s, 50s, 60s, 70s, but just to keep up with their screenings. So I think what I would like to do now, if you don't mind, I would like to start with some issues primarily germane to my younger female population. Of course, if you two are in that population. And I'd like to address eating disorders. I know we talked about what's optimal, how good dietary intake, but as like cancer and heart disease and all these things that people just really blew off during the pandemic, I can tell you, because I've been in very close contact with the National Eating Disorders Association to get the latest statistics. People with eating disorders did absolutely terrible during this pandemic. There has been a 54% increase in calls to the help center and the National Eating Disorder Helpline, which, by the way, I will give you that number. I have to say this for you or your patients or your loved ones that need this, because this is something that people don't like to talk about. And I have to tell you something that has happened as a result of the pandemic. Many of our younger women, I should say girls. Some of them are girls, some are young women. They're on social media all the time, particularly TikTok. And TikTok has not done a service to help these young girls not develop eating disorders. I mean, they'll say eat 6 grapes a day and do this many push-ups, sit up, whatever. And these young girls think whatever they see on this site is what you should do. So there's really been a lot of negative talk in the arena of eating disorders, especially with younger girls developing eating disorders as a result of seeing what they think is ideal on TikTok. So why am I stressing so much on eating disorders? Because I truly believe that we, as members of the dental team, are in a phenomenal position to help identify these patients. And I'll go a step further to say it's really the hygienists, because they're usually the ones that, and I'm not just saying this because all of you out there, or I guess the majority of my audience are, but you're usually the ones picking up on this. So if you will, when you talk about eating disorders, you're talking about a multidisciplinary type of issue. You're talking about something that's the second highest mortality rate of all psychiatric problems. It was number 1 until substance abuse, opioid addiction took over, and now it's number 2. It's generally the anorexic that is more prone to suicide. That anorexic is the one that restricts the caloric intake on a daily basis, and sometimes they intermix that with binging and purging, which is really bulimia, but a lot of anorexics go back and forth in a cyclical nature to interject restrictive caloric intake coupled with binging and purging, etc. So what we're seeing now is a disorder that is encompassing all organ systems. It can, as well as our mental well-being. In addition, we know that the mortality rate, not only from suicide in the anorexic, but also bulimic or anorexic, can die of sudden cardiac death, because what happens in the extreme cases, they get a cardiac, they have an electrolyte imbalance, and they get a cardiac arrhythmia, and that can contribute to sudden death. When I was growing up, and we had one of the very famous people of my generation, a singer, was the first person I ever heard to die of an eating disorder. And this is when I was much younger. It was Karen Carpenter. Now, you may have heard of the Carpenters. I know you're younger, but it was a brother-sister team, and she was an anorexic and died sudden death, cardiac death. So the other person, it's always a celebrity, that puts it on the map as to why we pay attention to this, was who? Princess Di. She put bulimia on the map, right? She admitted during one of her BBC broadcasts that she had been suffering from bulimia. So that's when we learned a lot about that. And then as I would go through the airports with all my traveling, my speaking engagements, every time I would look at People magazine, it was Nicole Richie. It was everybody, all these stars wanting to be thin, right? So they're going to do whatever it takes to have that cachected, wasted away appearance. Now, interesting to note, most people with bulimia, which involves binging and purging, do not look thin. They look like the normal average person. And when I say the bulimic engages in binging and purging, it's binging, meaning you eat a lot of calories in one time, usually very secretively, and only to purge yourself, whether it be via vomiting, exercise, over-exercising, diuretics, laxatives, or a combination of all those things. So that's the purging. So you're eating all these calories. So let's say normal caloric intake for a 120-pound woman, 1,500 to 2,000 calories a day. Compare that to someone that's binging. They may consume 20,000 calories per binge, only to purge. So I bring this to all of your attention. Now, the other thing is the anorexic usually looks thin, usually. But I have to tell you, I saw someone, I happened to be turned on as I was getting dressed one morning, Good Morning America. I don't know if you saw this past week. And I don't remember the woman's name, but she was a plus size woman. And she was talking about eating disorders. And she claimed that she was diagnosed with anorexia. So I'm thinking that she probably was diagnosed because she was restricting caloric intake. I don't know. I'm not her psychiatrist, psychologist, or whatever. But she didn't fit the mold of what when you think of the anorexic patient that looks, person that looks hectic and wasted away. So I learned something, and it was very interesting listening to her story. So how do I feel that we have a major impact here? Well, you know what? Let me share something with you before I go on to the oral manifestations I'd like you to be aware of. When I had a conversation with the people at the National Eating Disorder Association, I loved what they wrote up about what these women, or not women, these people, because it can affect men too. But by the way, 90% of eating disordered individuals, 90% are women, but 10% are men. So they said, in this time of great uncertainty and disturbance, we face the added danger that isolation brings to those that are struggling with an eating disorder. It is an especially difficult time for those who are struggling with eating disorders due to the issues around accessibility to care, concerns about food and exercise. So they have all these concerns. Remember, the typical person with an eating disorder wants to take control. And during this lockdown pandemic part, they didn't have that control. It was taken away. So I thought that was very interesting of what they said. So how can we be instrumental in helping to diagnose this situation? Well, a high percentage will come in with oral findings. The most common oral finding associated with purging via vomiting is a situation known as perimyolysis. Perimyolysis is the smooth erosion of the enamel where the dentin is left exposed. And in extreme situations, you'll have pulpal involvement. So it looks in the beginning stages like glassy appearance, very smooth, usually starting first on the palatal surfaces of the maxillary anterior teeth. When you question your patient about this, they will most likely tell you everything that they read on the internet as to what can cause this erosion. They drink too much wine. They swim in a swimming pool where the pH is off. They have GERD, gastroesophageal reflux. They'll come up with the whole scenario because they know that something's not right, and they look up all this stuff on the internet, and this is what they find. So you have to approach the subject very gingerly with these people. The other thing you want to look for in the initial stages of purging via vomiting, they can't just do it on demand. They need to use something to reach the posterior, the junction of the hard and soft palate to elicit the gag reflex. So very often, when you look in that juncture, you're going to see an ecchymotic area. Now, I know there's lots of things that can cause that, but we're not going there today. And it's generally, in this client group of people, it's due to objects or their fingers that they're placing in their mouth to elicit that gag reflex. So while I mention it's usually pointer and middle finger that they're using, I know you can't see my fingers. I've held them up, but you can't see. You need to look at their knuckles, because when they do this over a period of time, they will get hypercalcified areas on their knuckles where it's abrading against the maxillary anterior teeth. That's assuming they have a maxillary dentition, which most do. They're called Russell sign. That's what it's called. It's named after Dr. Russell. And it's actual I wish I could show you a picture, hypercallus formation on the knuckles. So that's another thing we look at.
I'm just curious too, because I was seeing a ton of patients. So when I graduated hygiene school, like those were all the signs, that you were taught. And then when I first started seeing it on a few of my patients, I was like, oh my gosh, I have somebody that has an eating disorder. And I saw it but I was seeing perio patients. So my population of my
Right.
demographic was more in the 40s, 50s, 60s. And it turned out that it was GERD in their situation. Is it a glassy type of surface that's more indicative of the posterior with GERD
Yeah,
versus
I
the
mean,
anterior with bulimia?
the bulimia classically it usually yes, it's mostly in the palatal surfaces of the maxillary anterior teeth. That's like the telltale sign.
Okay.
Yeah, and then other things to look for on their face, because remember, you have a captive audience here. You have them in your chair. What are you looking at their face? There's a lot of head and neck issues. First of all, in the extreme cases, they start growing little hairs. It's called lanugo. They have all these hormonal imbalances. So if it's a female patient, they start having like fine hairs growing in their face. They also very often have angular cheilitis, either due to nutritional deficiency or from irritation when they're initiating the gag reflex, or of some of these people are overclose their bite when they have such destruction of their teeth. So many of those things can cause the angular cheilitis. So you have the angular cheilitis, you have the lanugo, which is the facial hair. You look for traumatic injury in the soft palate, as I just mentioned. You look at their knuckles. And one of the other things I'd like you to look at, which may be the reason they've come in to see you, is they have parotid gland enlargement, cyalinosis. 10 to 50% of people with eating disorders, and when I specifically with vomiting, will develop unilateral or bilateral swelling of the parotid gland. It's painless. You can use hot compresses. I don't want them sucking on candies, lemon candies all day long. You're going to trade one set of problems for another. So I do not recommend that, even though the medical literature tells them to do that. In worst case scenarios, you may need to give them like pilocarpine, which is a drug that can reduce the swelling if they need that. So you have a lot of telltale signs in the head and orofacial head and neck region that may be a telltale sign that they have an eating disorder that they don't want you to know about. In the meantime, whether they tell you that they have it or not, you need to address their dentition. You're going to give them fluoride treatments. You'll give them like a 5,000 part per million sodium fluoride dental paste prescription. There's a lot of new treatments out for this erosion. But the bottom line is you need to get these people help. They have to try to open up to you. You need to address the issue. There's a whole questionnaire. It's called the SCOFF questionnaire. You can hand to the patient, which if anybody wants it, I'll be happy to send it to you. If they answer yes to like these 5 questions, there's a high probability they have an eating disorder, and it's from the psychiatric literature. But bottom line is you need to get them help. They need probably a multidisciplinary eating disorder center, a private psychologist or psychiatrist specializing in eating disorders. But here's the thing. It depends how far along they are. If they have acute medical problems, they need a hospital setting. If they just have the eating disorder without any encumbering severe medical issues, well, they can go to an eating disorder center where they're either treated as an outpatient or as an inpatient. So it really depends where they are in the course of this disorder. But the bottom line is you need to keep addressing it. If it is a minor, it depends what state that person lives in as to how comfortably you can approach it. But I feel this way. If their health is in real jeopardy, I'm going to get the parents involved and the pediatrician, because forget HIPAA. If they're in bad shape, you've got to get these people help. And I'll deal with the ramifications later. But I like to discuss it with their pediatrician if it's a minor, young. And eventually the parents need to get involved anyway because of the insurance issues. So this is a really, really big problem. I want you to know that the website is www.nationaleatingdisorders with an S on it.org. And I want you to have the helpline, because if you have a patient and they're in desperate need of help, they should call 800-931-2237. So you might want to copy that down, 800-931-2237. It is a helpline. There are people there all day. I think
We'll
it's all day.
put that in the show notes as well. So
Okay.
everybody can go check out our show notes and get that information if they
Okay,
so need
that
it.
would be wonderful. Okay, I know I probably have left out a lot. I'm not using slides for this, by the way. I'm just trying to do it off the cuff to get as much information. There is another issue I want to bring up, which also manifests itself most commonly in the younger woman, teens, 20s, 30s. And that is something else that, in addition to eating disorders, which went escalated during this pandemic, this too is off the charts. And that is intimate partner violence. You may still call it domestic violence. That's fine. I think today, politically correct, it should be intimate, but I still see some things in the medical literature that call it domestic. But it's in IPV, intimate partner violence. What's happened during the pandemic is that a lot of women, by the way, it most commonly affects women. Yes, it can affect men, but it is a really serious issue. It can be emotional abuse, sexual abuse, financial. It can be physical abuse. I think what's really important to know is that there is a high probability if physical abuse is involved, that you should keep this in mind. 75% of the victims of intimate partner violence with physical abuse, 75% will have head and neck orofacial findings. Let me repeat that. Very common is physical abuse. And if there is physical abuse, the head and neck region and oral cavity are prime targets, as the breasts, the abdomen, and the groin. But obviously, they're not going to be coming to us with that. They're either going to go to an ER or a medical doctor for those. But we, as members of the dental team, may see these patients in our office. And what's the telltale sign? Very often, it's the perpetrator that brings them in, and they will not want to leave your operatory. Now, when I was at the hospital at the time, they didn't want to leave the examining room in the emergency room, but you have to have them wait outside, because you need to question this patient if you're highly suspect that they were a victim of violence. Now, what they generally do, they're going to make up all these stories. It was icy, they slid into their mailbox, you name it. I've heard everything. And you know in your heart, that's not what happened. You're just so highly suspect that someone caused this bodily damage. So what you have to do, you have to try to get them to talk and to admit to it, and make sure they want all healthcare providers now to make sure that before you dismiss them, they feel safe in going home. And if not, you have a responsibility to call up whatever resources you have in your area where you practice, whether it be women's shelters, whether it be there's all kinds of community resources for battered women. You need to get them there safely. It is a tremendous, problem today. And unfortunately, so many of these women were in a household during this pandemic with their abuser, and they couldn't get out or do anything about it. So I am sure we have a lot of underreporting going on here. We don't have the tally, but certainly it's a major problem.
I just actually saw a 911 call where the woman ordered a pizza, and they were like,
Yes.
did you see that? Like, she's like, I'd like to order a pizza. And he was like, do you also need medical attention? She was like, no, pepperoni. And he was like, no sirens. Like, when you pull up to this, we have somebody. I was like, wow, that's great.
It was so smart. The whole thing was so smart.
And that's great to hear. And then there was the other, like if people were doing Zooms or FaceTimes or whatever, there was like a hand signal that was during the pandemic. Like you could hold up like 3 hands or something. I didn't hear that. Like that. What was something? It was something about a hand signal, and I should know this, but it was like the fingers were up or fingers were down, or it was like how you do it almost. And it was just to signal that they were not safe and they were not able to talk about it. And I was like, wow, and not just domestic abuse, but like sexual abuse, and especially of children happening over the pandemic has been very disturbing. Machell, have you let people back into your waiting area at your office?
Yes, we still have them distanced in our office, but we are letting people in the waiting room.
So we're joking. We're like, we might not go back to having people come in the waiting. I'm still like telling people like, we'll call you, come up to the porch, we'll open the door and you can come in. But so and I've actually very much enjoyed that. So I don't have that person like, oh, can I hang out? Like, no, I don't want you in the room with me unless I absolutely need you for physical or emotional support because it's a child with like that I can't handle personally for whatever. Like that's the only time I want somebody else in the room with me for these.
How am I doing on time?
We're good. You're way over your 50 or not way. You're 56 minutes, so we can wrap it up at any time.
Well, I promised that I would address this, and then maybe you'll have me back and do my pregnancy and all this other stuff that
we would love that. Yeah,
postpartum depression, all this. Okay, but I really would be remiss if I didn't talk a little bit.
No, let's talk about
it. The number one killer of women and men, but we're talking about women, is heart disease, and women are not taken still seriously about this, and too many clinicians are missing it in women, telling them it's stress. I would like to go on and document. I have all this literature to support the fact that the majority of women out there, even very educated women, do not believe that heart disease is what's going to possibly kill them. Everybody thinks breast cancer is the number one cause of death in women, and it is not. I'm not minimizing that, but it is not the greatest threat to their health. It is heart disease.
650,000 people a year die of cardiovascular disease. That is more than the 600,000 combined cancer that die a year.
Great. Wow. So, and the avid now. There's a lot of things going on. Not only are clinicians missing this, and when they go to the ER, they're not taken as seriously very often, but women also do not believe that some of the symptoms they're having could be cardiac in origin. So that's the thing. So when the average person thinks of having a heart attack, you think of what generally men are experiencing, that crushing substernal pain. Unless they're having a silent MI, which is only picked up on electrocardiogram. But generally, when you think of, I always remember growing up, there was this show, Sanford and Son. Oh, I know I'm dating myself. Anyway, it was Red Fox. Red Fox, if I have any people my age or around my age in my audience, you'll remember Red Fox. Do you remember? He was a risque comedian. And he had this dodo son, Lamont. And whenever Lamont would screw up, he was a widower and Elizabeth was his wife. He would go like this on it. Well, you can't, my audience can see me, clutch his chest and say, Elizabeth, I'm coming to get you. So that's what you think of, that crushing substernal pain. Anyway, women generally do not get that. They get vague kind of discomfort very often in the abdominal upper chest, in their back, shoulder pain. They may get nauseated. They may get a little diaphoretic, start sweating, but they don't usually have that crushing pain. Now, what I want you to know, there are two signs that could be cardiac in origin that most women tend to say, oh, it's stress. Insomnia and extreme fatigue. So in other words, what is that? You wake up in the morning after a good night's sleep and you can't function. That's extreme fatigue. And also insomnia. Those have been reported in some women that went on to have a myocardial infarction, and about 1 month before they started having those symptoms. So I really recommend, everybody knows their own body. If you are experiencing these atypical things that are just not normal for you, you've got to get it checked out, and you demand the best workup. Women are not counseled as often as men about cholesterol, nutrition, exercise. They do it for men to prevent, but not so often with women. So I really don't want anyone, and you know what? If you think it's cardiac, you get yourself to a hospital, and don't let your friend or your loved one drive you. You call 911, because if God forbid, and this is what I always tell dentists when I lecture on medical emergencies, God forbid you have an arrest in your car, what are they going to do for you? So if you're highly suspect, it could be cardiac, or you're having a heart attack, whatever, you get in and call 911. So too many women are just not making it because they don't act on symptoms that they've had because they don't believe it could be their heart. And I just really feel very strongly about that.
I was trying to think of where I just heard this or read it. And this is the problem with taking in as much content as I do. I kind of forget sometimes where I got this piece of information, but somebody was speaking to why women, and I know everybody probably has their opinion about like Western medicine, holistic medicine, essential oils, all of that stuff. But somebody was speaking to the fact that a lot of women went into the more like MLM, here, do these things to feel better, essential oils to feel better, anti-vax, a lot of things. They kind of went away from Western medicine and traditional medical care. And the reason that they were hypothesizing this happened is because they weren't validated. They weren't listened to. They weren't counseled. They would be told, you're just stressed. You shouldn't be so emotional about these things. Like, it's fine. Here's this medicine. And then this other world, this other side of, medical care, they were getting validated. They were being listened to. And that is why a lot of people have a hard time coming back over on the occasion to, like, I don't know, go to the hospital or get, breast exams and things like that, because they have been just not validated for a really long time. The patriarchy.
Yeah, well, I'm real big. I really recommend to my audiences, as you get older, that there are docs out there that specialize in the mature woman, and they listen to you. And they're really well versed in what women as they age are going through. And I think the very best advice I can offer to my audience is that you need to find that trusted healthcare professional that will give you the time and listen to you and offer that. And really, you may take a few tries, but there are those doctors out there and PAs and nurse practitioners, let's classify as healthcare professionals, that will give of themselves to listen to you and provide the best care. I truly believe that.
I do too. You have to ask around, and I'm so blessed that we get to work with some really great physicians, nutritionists. We're collaborators, and we believe it takes a village.
Yep.
But I know, and really what fueled that for me more than anything is that a few years ago, Machell, you may remember this, I just got really sick, and I'm a morning person, and I wake up and go, and I'm excited, especially once I grab that first cup of coffee, just smell it. Like, it's just, and, I was traveling a lot, and then I went on a mission trip and I got a parasite infection. Look, there were a million things. It was like the perfect storm with me. But after a couple of months, I could not get out of bed. I was living my best life ever. I was doing things that I never even dreamed of doing. And these doctors that I was going to, they were just saying, oh, it's stress, it's nothing. They were doing all this testing, but it was standard of care testing. And I was asking for more. And it really took going to Dr. Gina Pritchard and Dr. Paul Thompson, who are more integrative functional medicine doctors, and diving in deeper and looking at my inflammatory markers and listening to me. And, I had like adrenal fatigue. I was overworked. And it took a while. And instead of going and working out for an hour, my trainer had to work out with me 10 minutes a day. And nutrition was a big focus, and finding out there was a lot of pieces to the puzzle. I had 4 doctors. Not one doctor asked me about my sleep, and I work in a sleep practice. Not one doctor asked me about my sleep until Gina, and we had already done a sleep test. Like, we already knew what that was, but I was just waiting for one to ask me. And I was waiting, like, they just didn't ask the questions. And like Machell, and like you, we study and research, and I knew my body. And so the fact that you said that, we know our bodies, we are our number one advocates. And if you know something's wrong, and I tell my patients this all the time, I don't care what your physician's telling you. I don't care what tests they've done. If you feel like it's not right, here, let me give you a couple of numbers. You go until you find someone that tells you what you need.
Yep.
Yeah.
Yep. Well, I want to thank you for having me, and
Oh, so
share.
good.
I'm sorry I didn't get to cover like a lot of the pregnancy, but let me just one more thing. If any of you are pregnant or contemplating pregnancy or breastfeeding, it is safe to get the vaccine. Some great data was just released this week, showing that the vaccine is efficacious when you're pregnant and that it's safe. And the good news is that the fetus will get the antibodies if you get it, while you're pregnant. And if you're breastfeeding, it will also go into that breast milk. So those babies will have those antibodies. I had to say that. But anyway, thank you for having me. If any of my viewers ever want to talk to me, I'm available on my cell or my email, which my host will be giving you, and I will definitely contact you. And if you ever want me to come to speak to your dental group, whether it be dentist, hygienist, anybody, I would love to come. And I have a whole variety of subjects, not just women's health. So.
Well, thank you. We appreciate you taking the time. And I got to say, what I took from this, that I've been hearing this message a lot lately, is that we normalized a certain, we've normalized this person that fits in this disease. Like, we think oral cancer, big men, sleep apnea, big truckers, women, really skinny that are anorexic or bulimic. And we know a lot more now. And so we really have to kind of keep our eyes open and don't make assumptions just based on what we think looks like the normal person for that particular disease. So, and thank you, Machell, for being my co-host today.
Barbara, you can't come back. Or maybe it's a trio now. Let's do it because we love Andrew.
Yeah, we do love Andrew. But well, Barbara, thank you.
I'm a regular now.
You're so welcome. Thank you for having me.
Well, another great week, another great episode. We thank you all so much for listening each week. If you haven't already, hit that subscribe button, whatever podcasting app you're using. Also, just a reminder, our guests are so fantastic that they love when you reach out. They love when you interact with them on social media. And you can interact with us on social media as well at Instagram or Facebook. We're also on LinkedIn. You can find us at A Tale of Two Hygienists. You can also go to our website, ataleoftwohygienists.com. And we would love for you to go there and subscribe for our newsletter. We have lots of stuff on our website. We have a learning center. You can search for any episode. This is an easy place for you to find the links for our CE courses and take the test. There's just so much more there. So head over to ataleoftwohygienists.com. And if you want, you can also send us an email. I'm Machell at ataleoftwohygienists.com. And then there's Andrew, who is Andrew at ataleoftwohygienists.com. And we just want to say thank you so much. If you love this episode and you're loving the podcast, we would love for you to subscribe and leave us a review. And, 5-star, go ahead and do it. 5-star, just hit that 5-star and then leave us a review. We really appreciate it. We love reading them. It fuels our fire. And we just appreciate you guys so much. I think that's it, Andrew. Anything else?
Nope, that's it. Have a good week, everybody.
Bye, y'all.